All right, so we're going to continue on talking about social policy. Um, so let's discuss some of the common themes that have come up so far. So we discussed how welfare benefits are influenced by this public narrative and how we talk about the problem, and that then affects public support for the problem. We also talked about how earned benefits are viewed differently in the United States than benefits that are means tested, right? So we call them means tested benefits. And those are different from universal benefits like public schools. We pointed out that we're going to discuss this difference of Medicare versus Medicaid later, but know that it ties into this idea of means tested versus earned benefits. We also discussed that there was a preference for policies that served people who were deserving, and that definition of who was deserving did change over time, but that there are particular groups that popped up quite often in the social welfare policies that we talked about. Those are mothers and babies. Although we should note that there has been a shift in the social construction of mothers, um, in that stay-at-home mothers used to be the ideal, and whereas there was a shift in the discourse and in social norms um, that pitted the stay-at-home mother with the working mother, and that now it is unclear whether stay-at-home mothers, or this idea that a mother should stay at home so that she can raise her children, makes them deserving of social welfare benefits, or if they are considered lazy, right? And I'm not talking about stay-at-home mothers that can financially stay at home because they have a partner that is able to pay. Many of the mothers' pensions before that existed wanted to allow the mother to stay at home and take care of the child versus having to work and raise the child. And that was seen as ideal. And so that mother's staying at home and her identity as a mother made her deserving of these benefits. Now, mothers are not necessarily viewed low income, persons who are low income, who are mothers, are not viewed the same, um, are not viewed the same as they have historically been viewed, and that may indeed be because of race. Who benefits from the policies has changed. The elderly have always been a class that has been viewed by society as being deserving of public assistance, public support, and public welfare programs in the United States. So the big takeaway from all this history that we looked at was that history shows us that middle-class Americans have been very willing to support um, public welfare programs by paying taxes, but more so when they're sure that these monies would go for what they considered worthy purposes, and that these purposes were ones in which they benefited from. So that not only it was other citizens benefiting, but that they benefited as well. So we talked about deservingness. There's actually been a study on this idea of deserving, and Jensen and Peterson did a study where they looked at citizens of different countries' social policy opinions, and they said that if we just use this simple heuristic, this simple question, are the recipients of the social benefits deserving or not, that we could predict support for social policies. And now what they found was that not all diseases were treated alike, right? So public support for funding or requiring the government to help persons that were ill depended on the degree to which that disease was caused by something the person could control. So it depended on blame, right? So here on this axis, we have should the government help people with the problem? And here we have was the problem caused by a disease? And so what they found was that there wasn't much public support for the government paying for disease-related conditions that resulted from obesity. And when they did some digging, they came to realize that that was because people blamed persons who are obese for their disease-related conditions. They could have controlled their obesity, and at least that was the beliefs. So participants in this study were more likely to find that disease-related conditions from cancer should be supported by the government. Should the government should provide health care, the government should pay for these services. And the reasoning for it was that the person who gets cancer shouldn't be blamed for getting cancer. It's out of their control. So what the study shows us is that the public views disease-related conditions differently and blames some populations for the disease that they, for acquiring the disease. And because they blame them, they don't support policy proposals or policy solutions that require the government to pay for or take responsibility for the treatment of these diseases. So this idea of deservingness is one that's found over and over again when we discuss social policy and health policy. Well, that wraps up social policy. And I'm going to go ahead and keep going and cover government structures so we can understand how the healthcare system is designed a little bit better. So we need some context here. I've come to realize that many college students don't remember high school civics. So we're going to do a quick review of government. In the United States, we have federal, state, and local governments. Local governments, you can think of them as your county governments and your municipal governments or your city governments. All right. Each of these governments have authority or power over particular areas, and sometimes they share their authority with one another. So when they share power, it's called concurrent authority. So when I tell you that the federal government and the state government have concurrent authority over public health, that means they both have authority over certain areas of public health. So each level of the government, we'll call these levels, because in the US they're hierarchical for the most part, the federal, the state, and the local. So at each level, the government is broken down even further. Now, this is particularly true for the federal and the state level. So we're just going to focus primarily, on the federal and the state level. Okay, the federal level, we have three branches of government. We have the legislative branch, which we commonly refer to as Congress. We have the executive branch, which is headed by the president, and we have the judiciary branch, which is headed by the Supreme Court. The founders of this country created these three branches so that we have checks and balances and so that we have separation of power, and that so that one branch of the government does not become too powerful, the other branch of government have checks over them to control the power. All right, so the legislative branch or Congress is made up of two houses. There is the House of Representatives and the Senate. And their role is to pass laws. That is their job. They pass laws. Okay? The executive branch, we said, is headed up by the president. The president then controls the administrative agencies or the bureaucracies. And these agencies are agencies like Health and Human Service, the Department of Justice, the Department of Education. Okay. Now, the role of the executive branch is to administer the laws that are passed by Congress. So they implement them. They make sure, so Congress usually passes a law that's pretty broad, and then the executive agencies, they pass rules, and those rules implement these laws. So they have quite a bit of power here. And so we'll see as we look at healthcare, the way the healthcare system is set up in the United States, we'll see that Congress may have passed a law, for example, the Affordable Care Act, right? And they then delegate authority for implementation to Health and Human Services. And Health and Human Services then has to make a lot of decisions on how this is going to be implemented. And they have to have some type of oversight. And they have to have some type of enforcement. What happens if states don't or decide not to do what they're supposed to do under the law, right? So that is the job of the executive branch. So they have quite a bit of authority there. And we know, the president is also the commander in chief, and oversees foreign policy. But we're more concerned here about the role of the bureaucracies in administering and implementing the policies. And then the judiciary here interprets the law to see and make sure that each of the government, the branches and the government agencies all acted within their constitutional scope of authority, right? So make sure that they had the power to do what they did. So some basic constitutional concepts that'll come up in our study of healthcare systems and healthcare policy is this idea of federalism. And federalism refers to the division of powers between the federal government and the state government. In the United States, the federal government has specific and enumerated powers. And because they have specific and enumerated powers, that means that we have a limited national government. It's a lot more limited than some of our European counterparts that have national governments that have more powers. So the federal government has specific and enumerated powers. Any powers that are not specifically enumerated in the Constitution then go to the state. So the state has what's left over. That's the authority. They have what's left over from the federal government. They also have police powers. Now, the federal government can also delegate their powers to the state government. So, for example, when we talk about Medicaid later, you'll see that Medicaid is a federal program where the federal government pays for the program, but they delegate implementation of that program to the state. That means the states come up with their rules for administrating it, and it usually has to fall within the federal rules, right? But what happens then is there's wide variation in Medicaid programs across the country. Medicaid varies drastically by state because the power to implement the program has been delegated to the state governments. In contrast, most European countries have stronger, more centralized governance. Not all European countries, but most of them do. And so their central government, their national government, has more power to create national programs, and there's less delegation to the states, which means that there's more uniformity in their program. Again, this is a generalized statement. This varies by country in Europe, but by and large, they have more centralized government than the US. So because in the US we have separation of powers, that can cause for some fragmentation and some decentralization. And as we said, differences by state, or county by county, right? So we talked about the checks and balances a little bit. So the checks and balances, it's important to explain only because what's been going on with the Affordable Care Act and the Supreme Court. So to understand the court's relevance in our healthcare system and health policy, you have to understand that the judicial branch has the authority to examine the acts of the other two branches of government, and they can determine whether that act was constitutional. So when the Supreme Court takes up parts of the ACA, they're looking to see if the legislative branch had the power to and authority to enact that law. All right. Now, keep in mind that there are other checks and balances. The executive branch oversees and enforces the laws that are passed by Congress for the most part. And so the success of a program can be greatly impeded by the executive branch if you have a legislative branch that's controlled by one party and an executive branch that's controlled by another. The executive branch can issue memorandums, they can enact rules that cripple programs. Also, the president can veto a law. The legislative branch, they enact the statutes, which is the law, but we said they're checked by the judicial branch that can change the laws. They also can check the president by overriding the presidential veto. That takes two-thirds of the legislature. So some more concrete examples of how these checks and balances affect healthcare policy. Well, when Congress passed the ACA, it required the states to expand Medicaid to include more populations, more categories of people than it did before. Well, the Supreme Court said that when Congress enacted the ACA, they did not have the power to require the states to expand Medicaid. And so they said the Medicaid expansion provision as written was unconstitutional. And so therefore, the states had the option to expand Medicaid, but if they did not want to, they did not have to. Right? So another example would be that if the legislature, under President Obama's second term, right, wanted to repeal the ACA, President Obama could use his veto power to veto the repeal. And I just wanted to show you an example of a state government so you could see that the state government also often has branches, separate branches that are that mimic the federal government. And so this is an example from the state of Ohio. The state of Ohio has a legislative branch. They also have an executive branch and they have a judicial branch. All right. And um, rather than a president, they have a governor, but you can see here that it mimics the federal structure. And that is going to wrap up your American Government Civics Review.